Yes, here on the news feed PM on Newsroom Africa, channel 405. Thanks for staying on. South Africa has technically entered the third wave of COVID-19. This comes after the National Institute for Communicable Diseases recorded 9,149 new cases in the last 24-hour cycle. For more on this, I'm joined now by Professor Adrian Purin, Head of Department at the National Institute of Communicable Diseases, as well as Dr. Harsha Sumara from the Gauteng Department of Health. Good to have you both with us this afternoon. Prof, let's begin with yourself. I mean, if you look at those numbers, those are numbers, of course, of not what is happening right now, but possibly an indication of numbers of what could have happened about 2 weeks ago in as far as the infections are concerned. Is the situation worse off today, considering that we are dealing with a more transmissible variant of COVID-19?
Yeah, so I think just to correct that, our understanding is that the variant that is in circulation is the same variant that was in wave 2, in other words, or the resurgence 2. But you're quite right, we need to be concerned that if the additional variants, such as the Alpha or the Delta variant, gets traction, then that may well paint a different scenario. But we're in this particular resurgence, the third resurgence, and the numbers are certainly climbing, as you can certainly see, but there are various scenarios that one can certainly paint, and has been done. Gauteng has been the outlier in terms of those scenarios, that it could have a curve as large as or larger than the second resurgence, or less. I think it just depends on how the non-pharmaceutical interventions and other interventions are going to be applied in order to try and stave off. But those are challenges I'm sure my colleague will certainly address in terms of how we go about this and what the scenario will look like over the next 5 to 8 weeks.
But Prof, from the NICD point of view, I mean, these numbers come after the 31st of May, which was 11 days ago, when stricter lockdown regulations were actually implemented. What does this mean? Does this mean we need to tighten things even more?
So those are considerations that the provincial departments of health and the National Department of Health will look at and make certain decisions. I guess it can be a very nuanced approach and readjustments, or it could be stricter lockdowns. Of course, if these results are showing that, in fact, we do have this sharp incline, there may be an inclination towards more stricter approaches, and in a nuanced way. Because remember, we're focusing on Gauteng, but you would not make that decision for example, KZN, which is in a different situation currently.
Right. Dr. Sumara, significant jump in number of infections, if you're particularly looking at the Gauteng province. There are some already reporting some level of strain as far as availability of beds in the Gauteng province. What strain is this placing on the health system?
I think, yeah, there certainly has been a rapid increase in the transmission of the virus in Gauteng, and as expected, we are seeing increased numbers of patients requiring hospital admission for COVID, and it has increased the strain on the health system. At the moment, I think there's still capacity in the system to cope with the numbers. I think in terms of the public sector capacity, we anticipate that there's still, we're 2 weeks out of reaching the threshold. Obviously, like you said before, we're dealing with the numbers, the cases from the transmission is being impacted by factors 2 weeks ago. So we're not sure what we're going to see in the next week or so. So the hospital bed admissions might increase more than expected next week. But yeah, after this, there are contingency plans in place to actually shift other categories of beds to become COVID beds as well. But we are hoping that the transmission will actually slow down in the next 2 to 3 weeks.
The transmission does not slow down by itself, Dr. Sumara. I'm sure you know that there needs to be mass containment measures being put in place. There are some suggestions, particularly around mass gatherings, to say that 100 number is still too high. Is the Gauteng department looking at that possibility of bringing down those numbers again so that we deal with mass gatherings, but also just tighter measures to impress upon the population the severity of these infections?
Yes, no, for sure. I think you mentioned the lockdown level 2 that was instituted nationally. I think at that point in time, perhaps it might have been appropriate for the country as a whole, but in Gauteng we were seeing a bit of a different picture in terms of the rate of transmission. So perhaps these measures were not quite appropriate for Gauteng at the time, but I think there's various considerations that the government needs to balance. And even though the government has recommended lockdown level 2, we're still encouraging citizens to take control of the situation and to actually not attend gatherings at all, never mind gatherings of up to 100 people. I think if there are gatherings that can be arranged safely, that could be permitted, but it is very difficult in these circumstances. And I think if people do not need to gather, especially with the rate of transmission at the moment, we would certainly encourage people to actually institute a personal lockdown of a higher nature.
Professor Piran, if you look at a Lancet study that was recently released, low COVID-19 mortality rates do persist, I suppose, on the continent. However, we have the highest global mortality rate in patients with COVID-19 who are critically ill. What is behind that?
Well, I haven't seen those particular figures, but yes, you're quite right that we do have a high degree of mortality, and that's the consequence really of a combination, and we've seen this in various other countries, and that it's in the older age groups in combination with comorbidities that we're seeing this high mortality. And again, given the fact that we had a virus which is thought to be or associated with a greater degree of transmissibility, and that has led to larger numbers that we're currently seeing, leading again to increased hospitalizations and ICU and ultimately death. So it's really a follow-on in terms of and related to the fact that we had most likely a more transmissible virus in terms of creating those larger numbers, leading to, and what Dr. Tamara has indicated, is that we don't really want to overwhelm our health system. If we do, then those are some of the consequences as a result of being overwhelmed.
Is that an indication, though, that we do need, I mean, I suppose it goes without saying, ramp up our inoculation of those in that particular age bracket with the kind of comorbidities that exist in that grouping?
Yes, absolutely. So again, if you look at the United States and in fact the UK and Israel and a few other countries, in fact, that were experiencing their so-called second wave, in fact, vaccines were really, by ramping up the vaccine program, that was really a key way in which the declines were actually observed. So yes, it would be great if one could achieve that. I think what has been achieved, though, is another vulnerable group is the healthcare workers. I think because, again, by vaccinating that particular group, at least one has some degree of preservation around the healthcare service. But you're quite right in terms of the broader requirements of expanding those programs to the vulnerable groups is really going to be critical.
How does this third wave complicate the vaccine rollout, Dr. Sumara, considering that, of course, there will be tighter restrictions on movements, but also generally a little bit of a heightened awareness?
Sure. I think it does complicate the vaccine rollout in the terms that we are encouraging people to not travel as much. Though I think you've got to weigh the risk and the benefit. The benefit of the vaccine in the long run certainly outweighs the risks associated with the rollout. But what's important is that on your en route to the vaccine rollout sites and at the vaccine rollout sites, we do need to follow the non-pharmaceutical interventions. I think we need to have stricter control, especially with these large numbers of people, that we actually adhere to the physical distancing and that everybody wears a mask and maintains good respiratory and hand hygiene while they're at the sites. And I think if we can manage that, it shouldn't impact the vaccination rollout at the moment. And like you said, the importance of the vaccine rollout now is really going to help us prevent the unnecessary morbidity and mortality in the next few weeks.
All right, we've spoken on capacity as far as beds are concerned. In terms of oxygen levels, volumes, do we have enough?
Yes, so I'm actually not from hospital services, but as I'm aware, at the moment there is enough oxygen. It's actually being monitored daily in conjunction with the suppliers and hospital services. So yeah, I don't think it's a concern at the moment.
All right. And Professor Piran, in terms of the picture of what the third wave could possibly look like. Are there any models that you're currently working with that could be possibilities, how severe it would be, or maybe less severe it would be?
Yes, absolutely. And so one of the models that is currently being developed is by the Modeling Consortium for COVID-19 that's led by the NICD. And the idea behind that is to try and see what is called a nowcast and a forecast of events in terms of hospital admissions and outcomes, and as well as mortality, to really assist the various departments at a provincial level to make key decisions around hospital capacity, oxygen supply, and so forth. So there are these short-term models as well that are certainly being introduced to assist the various provinces around trying to forecast what their requirements would be over the next week or 2 weeks at least, yes.
And what are the inputs into those models, and what would be the possible outcomes?
So there are various parameters in terms of positivity rates, admission rates. Various forms of data are put into a model in terms of various parameters, and that, I suppose, generates what the requirements would be, or what the forecast would be in terms of hospital admissions or hospital bed requirements, or mortality, for example. And these are really short-term, so again, there may be wide, what we call confidence intervals, but it will give some indication as to what the trajectory would look like over a week or at least 2 weeks.
Prof, appreciate your time, and thank you very much for joining us this afternoon. That's Professor Adrian Purin, Head of Department at the National Institute of Communicable Diseases, as well as Dr. Harsha Sumara from the Gauteng Health Department. Thank you both for your time.